first aware that something was wrong, it was a couple of years ago now, when I started to experience some quite subtle sort of symptoms, but didn't necessarily realise at the time.
Shortly after I got my fourth child, I started to feel a bit more tired than usually. I was worrying feeling, felt a lot of anxiety, didn't really recognize myself. I had also different moods and I started to gain weight. And I also got dry skin. And yes, didn't really feel well, and it just got worse and worse. Then when my oldest son Fredrik started to feel some symptoms, I first didn't think about it anyhow.
I would say it was about 12 years ago, and the first symptoms was that I was always tired. I was playing ice hockey at the moment, and at an elite athlete level. As you can see, it was several years ago, but at that time I was mainly feeling really tired, and I was also feeling that I was kind of sick all the time. I didn't feel well, so I went to the doctor several times, my house doctor, and he always said that you probably got a cold or some virus infection, so it took a while to discover what I was really suffering with. But
I was eating lots and losing weight at the same time. Experiencing mood swings when generally I'm not a particularly moody sort of person, don't normally go through differences in moods.
I felt really tired. Eventually I also got a little bit depressed by this, and I also suffered from headaches, and it was getting worse and worse, so eventually I had a headache every day. I played ice hockey, so I didn't gain weight. I didn't display the obvious symptoms otherwise than being tired. But I think at that age, that's quite normal for a teenager to be tired and a little bit lazy. But it got to one point where my family said to me that you're like a zombie, because what you do is only you get to your ice hockey practice, and when you get home you just fell asleep. So that was the point that we realized that something else than just being sick or having a cold was the case. So we needed to investigate this further.
When I look back at the symptoms that I experienced, the best way that I can describe it really is like having a shot of caffeine, a massive shot of caffeine in the morning, because everything about your body is just sped up. At work, I was finding it quite hard to concentrate for long periods of time. I'd say I had an attention span like a gnat. It was really, really short. And obviously with a lack of concentration, you know, you can easily start to make mistakes.
If you have a hypothyroidism, which is an underactive thyroid, then it really slows down all the functions of the body, because the thyroid is really the engine of the body, and you need the thyroid hormone to get all the cells and organs in the body to work. So it slowly shuts down the organs, and yes, if it goes really bad, then you even can die from it.
I think it's more common in older women or older people, but I think it's becoming increasingly common amongst younger women as well. So it is important for people to be aware of their bodies and listen to the subtle changes that you might experience, and go to your doctor to seek help if you think something's not quite right.
Unfortunately today there is a great lack of awareness among the GPs and among people in general about thyroid disease. Many people doesn't even know what the thyroid is or where it's placed, and it goes in the genes. I have 4 children, and 2 girls, 2 boys, and the boys both got hypothyroidism, an underactive thyroid, when they were in the age of 16 and 17. I guess I felt a little bit guilty about it, but at the same time it's a disease that you can live with, but of course you don't want your children to be be sick in any way. I would really advise people that either themselves feel the symptoms of getting tired or gaining weight or losing weight and not feeling themselves, getting worried or whatever, the symptoms that we mentioned, then really don't hesitate. Go to your GP or some other healthcare personnel and ask for getting the samples done, because it's really such an easy test. It's a blood sample to get to know if you have problems with your thyroid or not.